AJ, I'd love
Yes.
to set the stage for people. You've spent your career trying to make sure that every American in the U.S. gets access to the pharmaceutical drugs that they need and at the lowest possible price. Would love to just hear more about your family history and what brought us to where you are today with Judi.
Well, it's interesting. You start with family my memories are my grandfather was a pharmacist, my father and his brother were pharmacists. And so obviously the family's like, you should be a pharmacist. And I thought that was the worst job possible. And I mean that with the highest level of respect, but I wanted to do something different than my parents. And so I did everything in my power to kind of step away from the family business. My father was an independent pharmacy owner. And, you go through this journey in life and it kind of pulls you in slowly. So fate or probability, whatever you believe in, is I came back somehow to pharmaceutical. So my first exposure was obviously working in pharmaceutical manufacturing, doing consulting around supply chain conversion systems, MRP to MRP2 to ERP, really dry work. I used to always say I had one of the most boring jobs in the world, but it pulled me slowly into pharma. And over time, that would push me into the payer side, insurance and claim processing, and ultimately running a pharmacy benefit manager or even a larger health benefit manager organization. And I go back to, did my father always know that I would somehow come back to the center and honor his career?
Yeah. Yeah, it's really powerful to, your grandfather bartered his way through pharmacy school, I believe,
Correct.
and spent all of his time dispensing pharmaceutical drugs.
Well, we're here in New York.
Yeah,
He came in a little island behind us, Ellis, the rest of our family from Italy. And, he started his career doing, everything from shoe repair to being a barber.
Wow.
His father had a thought that everyone needed to trade, regardless of the goal was to get to higher education if you could. But everyone had a trade in the family. And so, I remember even as a child, I used to go to my grandfather's house and get a haircut. And so for him, it was a journey like his brothers and sisters, but I don't know if it was his mother or his father or both of them, but I think, out of the 12 brothers and sisters that he had, I think all of them went through college.
Yeah, amazing. And so what does it mean to you to be building Judi today, which is focused on bringing more transparency into the industry that your family worked in for so many years, building that company that is sort of disrupting the very process and supply chain of the drugs that your family distributed for so many years?
Yeah, I think, if I go back, my thoughts of a pharmacy have less to do with the prescriptions. It's, putting out the Sunday paper. It's, everything from consumer goods in the aisles, to paper towels, to, items of convenience and stocking those shelves. But what you think about when you're doing that is you just kind of assume there's the same efficiency in price that you have for deodorant or paper towels or Tylenol that you have with something that's behind the counter at the pharmacy, the prescription. And I believe this for, gosh, probably into my 30s. I just always assumed drug pricing was efficient and transparent. I always say, a market is efficient when buyers and sellers freely communicate on price. And the example I always give is, if you wanted to buy a new color television, you go online and you say, this is the model I'm interested in, and there'll be 6 different ways that you could purchase it, and the price is plus or minus 1%. That's a hyper efficient market. I assumed, and this was a false assumption, that prescription drugs were fairly priced. And I say that because I go back to where I spent the first 8 years of my career in industry was working with pharmaceutical manufacturers. And that And when you work in that setting, drug pricing is very stable.
Mm-hmm.
You know, I often say you could set a clock to brand drug pricing in the United States. Branded drugs, we change price typically January and July.
Mm-hmm.
So there shouldn't be any price changes in between. And then generic drugs follow a similar pattern based upon your purchasing schedule. That could be a month, every quarter. The price gently deflates over time. And so I just assumed while I was working in the manufacturing side, drug prices were fairly priced. And it wasn't until 8 years into my career, a friend of mine came to me and said, "Hey, you're pretty good working with databases. Could you look at this claim file?" And I said, "What am I looking at?" And they said, "This is a PBM." And I go, "What's a PBM?" And they're like, "A pharmacy benefit manager." And I'm like, "Come on." I'm like, "What is this thing?" And I was just like, this makes no sense to me. I'm like, a PBM? I go, I know like carriers and health plans. I go, but what is this mysterious entity? And they said, well, this is what prices drugs and manages prescription drug plans. And so I looked at the file and I said, hey, your file's corrupted. And they said, why do you think the file's corrupted? And I said, it looks like drug prices are changing every hour of every day in every pharmacy for every drug, and this is a complete lie. And just think about that last, word, lie. I was like, this is false.
Mm-hmm.
And I go, so it can't be. You can't have 600 different prices for a branded drug in a month. That's obscene. And so I said, give me another file. So I looked at another file and it was the same pattern again. And that's exactly what it was. It wasn't an anomaly. It was a pattern of abuse. And who likes variability and opacity? Somebody who's setting a market price. Mm-hmm. If you don't understand what the price of an object is, it's very hard to think about what's fair. And if you're trained to have different prices, you just assume that's the way the market works. Now, what's interesting is most people don't really feel the impact of a prescription, what I would say, for the first 20 years in the 21st century. And what I mean by that is most people had flat copays. You go into the pharmacy, you pay a flat $10, and that's what you pay. The drug could be $500, the drug could be $5. You pay $10. That's your flat copay. But with the introduction of coinsurance and deductible plans, people now would pay the full face value of the drug, or percent of that cost. And they started to notice more of this variability. And so when I saw this file and I saw the abuse, this is what drove me to leave the manufacturing side and create my second company, which would be, let's audit these workflows. Let's help large companies make sense of these PBM arrangements. Let's bring some truth and clarity to drug pricing. And I would do that for 8 years. And I became over time kind of, equally depressed by the result, that I felt like nobody wanted to change. And so this would lead me ultimately to the creation of Capital RX, which would become Judi Health.
Yeah, it's such a powerful story. I mean, because I assume that the work that you were doing, consulting for pharmaceutical companies and then working with employers to better understand this landscape, I'm sure was a pretty great gig. What was the moment for you that felt like you needed to go further and own more of this solution personal in the backdrop of building what is now Judi Health?
Well, I always say you learn something from each of your business experiences. Mm-hmm. So like my first company was straight up consulting. I had a bench of maybe 30 engineers and consultants, and we work with pharma around the globe. And one of the things I learned was ambition. So this was my first small business. I bootstrapped it, used my credit card, the American dream. And I built this, robust business, which gave me a, comfortable lifestyle. And I thought this was the goal. And what was interesting is I attracted the attention of a partner from Accenture. So I was working on large projects with Pfizer. Mm-hmm. And a lot of the work I was doing, the project was owned by Accenture. So I would almost be their subcontractor on a lot of these programs. And we kept showing up for the same projects over and over again. And he said, we would love to bring you in and we'd like to buy your business. I'm like, oh my gosh, someone's interested in something I built. This is amazing. I'll never forget this. I went into Accenture's office building in New York City, and they bring me into this lovely conference room. And I get to the first question, and I failed. And the first question was, you've built this amazing bench of 30 engineers. What is your business plan to get to 300 engineers? I was like, 300 engineers? I'm like, I don't have a business plan to get to 300 engineers. I'll never forget the look on this partner's face from Accenture. He just pushed himself back from the table and was just like, this is a lifestyle business. And I know what the word lifestyle is. I'd never been necessarily introduced to the term lifestyle business, but he said it with such disdain. He was just like, yeah, like, this is over. And I went home and I did not sleep. I felt as if I needed to do better. And this is this concept of ambition, where someone's just like, hey, wake up. Like, you've been at 30 engineers for 3 years. Like, you've plateaued. Like, what are you doing? And to be fair, I'm the son of a pharmacist and a public school teacher. I had never been taught that level of ambition. My parents taught me to be a good person and to make enough money to pay for my bills and live a comfortable lifestyle. So I think for me, after that, although I did not sell to Accenture, I did sell to Chrysalis out of India the year later. This partner from Accenture awoke something in me. And that was, lesson one. And I was looking for something to do. And as fate would bring it, this claim file of PBM data, and it married with kind of my beliefs and wanting to correct a system that I felt that I was uniquely positioned to fix, because I came from manufacturing and I understood the pricing the American consumer had was a lie. And I said, well, we must fix it. And I will find people in that we to follow me. And that would be my next business, where I wanted to build an entire company that would help, hundreds of employers. And we built a great business again. This time we scaled it to 150 employees, and, much larger business where we attracted venture capital investment. But there was a lesson there in that company that changed me forever as well. And I'm sure we'll get to that at one point.
And how many engineers does Judi have today?
Oh,
To put it into context.
1,500 employees, 400 engineers.
Yeah. So you've surpassed that
30.
the early plan of what will the ambition.
We hire 30 probably every 2 weeks at this point.
It's
interesting.
It's really incredible. Okay, so I'm not sure I can wait for further in the conversation. Would love to know what was that important lesson that you learned in your second company.
Yeah.
That has carried through to building Judi.
I think the second company, came in parts. The first one is you could start with a noble purpose. The purpose of my prior company was to audit these claim workflows that were very complex of pharmacy benefit managers, and then help the employers. But what I discovered over time is nobody wanted to really move in the direction of real change. So we would work with PBMs and be like, hey, we noticed this problem. Wouldn't you like to fix it? They're like, no. And you're like, oh. Now, you would think, don't you have leverage against them? But the problem is the industry is so tightly consolidated that, 3 entities, CVS, Cigna, United, we needed in every bid for the most part. And if someone didn't bid, it would be quite noticeable. Like, well, why isn't this PBM showing up to your RFP for us? And so we went to them and said, you should make these changes. And they would start to threaten us back and say, well, I'll just no bid you. I'm just not going to participate in your bids. Now, if you're working with a Fortune 500 company, they would be like, I want the 3 biggest vendors to service my plan.
So it would have been directly damaging to your business.
It would be. And so what I discovered along the way is we had become complicit in the problem. That to keep the business going on some level, we were starting to ignore our mission. And that bothered me. The second part of it came from my board of directors, where they said, we've grown this company to a large enterprise of $250 million. how do we get to $1 billion enterprise? And I took it very seriously, that task from my board of directors. And I studied and thought about it and thought about it. And I went to my board of directors and I said, I think we need to sell our core business. Now, just think about that.
Mm-hmm.
They're asking you how to build the core business bigger, and my solution is to get rid of it. And they're like, what are you talking about? And I'm saying we should sell the procurement and audit business. And I had already found a buyer.
Mm.
And it was actually my friend Mike Mealy over at Gallagher Benefits at the time.
Mm-hmm.
And I called up Mike, who was the president of Gallagher, and I'm like, hey, I'm thinking of selling this. What would you buy it for? And a number was relatively like 65 to 70 million based upon, our revenue against the business. And I'm like, well, this is a chunk of change for funding to move to this. And what was the business? The business was, if you can't fix the problem, become the problem, become a PBM.
Mm-hmm.
And I pitched that to my board of directors, and they thought I was insane. And so much so, they asked me to leave the room, and I think my career changed at that moment. But I always want to pause, because this is what I tell my team all the time, and I call it the Netflix moment. And I'm sure you've heard me talk about this.
Yes.
But this is important, and I say this to anyone who's starting a business, is you have to be willing to disrupt yourself, because someone else will. And I think about Netflix, if you go back 15, 16 years ago, they're mailing me DVDs to my home.
Mm-hmm.
They had to go to their board of directors and say, this business that pays for everything? And they're like, oh, yeah, we're killing it. This is an amazing business. Be like, we want to sunset it.
Yeah.
And we want to move to streaming subscriptions of reruns and old content. And they're like, you what? And they're like, yeah, just hear me out. And they won that argument. This is why I don't have any ill will towards my old board members, is I say, I lost that argument fairly. They gave me every opportunity to win that discussion. And it taught me a lesson, is just because you have a great idea, if you can't translate it and build conviction, you're going to lose that argument, obviously. And so, going back to Netflix, is not only did they win that argument, they went back to their board 5 years later and they said, I want to become a world-class production studio like Sony or NBC, Paramount. And they're like, you want to make your own content? Nobody does that. They're like, we think we can. And now they're the leader in making their own content. And they disrupted themselves again. But in doing so, the entire industry followed them. Think about it. People went to subscribing models and streaming models. People went to building their own production companies, even companies like Amazon to Apple. Think about that. And so I go back to where I was, and if I couldn't chase this model that was going, to be discussed in my old company, I was going to found my new company, which would be Capital RX. But these were the lessons, which is stay true to your mission and then be willing to challenge yourself and disrupt yourself and follow wherever that will take you. If you truly believe in the prior point, I believed in the mission. I believed we needed to fix the way drugs are priced in this country, and that would create enduring social change. And I say this all the time, the enduring social change is important because nobody should be confused or taken advantage of when you're getting a medication in the United States. That's a shameful act, but it happens at hundreds of thousands of times every day in this country still. And that was my mission and purpose, which obviously led me to Capital RX, but leads me to a question for you. I would meet you 4 years or so into our journey, and you talk about conviction of your investors. What was it that made you interested in Capital RX at the time?
Yeah, it's a great question. And first of all, I'm thankful for that moment that you had in your prior company that gave you space to now found Capital RX, now Judi Health, because you're building some of the most important infrastructure in our healthcare system. And we spend so much of our time at General Catalyst thinking about how do we transform healthcare. We've been very intentional about our health assurance thesis and how do we bring more proactive, affordable, and accessible care to everybody. And so in that, we know that there are going to be a number of core platforms that need to be built and collaborate to change the way that healthcare is delivered in our country. And going back to 2019, what was very much at the top of my personal list was the pharmaceutical supply chain. And I remember the first time I was architecting and refining the thesis for, wait a second, why is it that on a day-to-day basis there are all of these changes and discrepancies in drug pricing for people, and when you show up to a pharmaceutical counter, you never know what it is that you may be getting on the other side from a pricing perspective. And so in that, you kind of have to describe all the different aspects of the supply chain and who gets what from a profit perspective, from the point of manufacturing the drug to, you know, the point in which you are receiving something from the counter or having it delivered to your door. And it was just fundamentally mind-blowing understanding the way in which the system had been working for so many years. And describing that to my partners, I think everyone's eyes crossed, right? Because it's a really complicated problem space, and one that has been operating the way it is for so long just because. And, you know, as, you know, the large incumbents in the space get more and more entrenched and more profitable because of the way that things have been running for so many years, it's harder to unwind. And so the push for me in thinking through this problem space is like, okay, I know this has to change, but can it actually ever change? Yeah. Will there ever be momentum around the understanding of drug pricing and transparency so that you can build a really big and enduring company? Because we know it needs to exist, but is it actually possible in the in the number of years that we're thinking about from an investment horizon standpoint? So kept thinking of, like, you know, this problem kind of wouldn't go away for me and wanting to solve, but, you know, I just really had never met the right team and the right business model that I thought could really solve this problem. And I remember I was actually speaking to one of your customers, who was building a digital health company, and she was just curious. She was like, "Oh, what other problems are you interested in these days?" And I was like, "Oh, well, you know, PBMs and the pharma supply chain." And she's like, "Oh my gosh, you have to meet AJ then." And she kind of went on and on as to how valuable Judi Health, what was then Capital RX, had been to her business, and just how knowledgeable you were about the space. And so I remember then I just cold reached out to you. I was just like, I think, you know, I'm really passionate about this and need to know you. And I think we then met a few weeks later.
Yes.
And I'll never forget it because you were wearing your COVID era Costa hat, which I now have learned is because you continued to wear it because it was a good luck charm. You started to win really large contracts.
Yes.
In that phase of time, and so therefore you kept wearing it, and it was part of your identity. But I think that initial meeting was scheduled for 30 minutes. Mm-hmm. And I think we maybe met for 90 minutes, and we could have gone on for much longer. And it was right in that first time with you that I knew, okay, this is the team. This is the team that we need to partner with if we're ever going to think about solving this problem at scale. It was just the way that how well you understood the problem.
Yes.
How you had elegantly architected your business model, and the fact that people were really starting to take notice. I mean, this was before a lot of the regulatory tailwinds that we're seeing today, well before, you know, Trump RX and the headlines. But it just felt like, okay, there's something here, and we can really create a movement around what AJ is building. And then if it was a couple months later, I think I, you know, finally convinced you to allow us to go into deeper diligence on a potential investment. And I'll never forget it because, you know, you're in these intense moments where you're really excited about a problem space and you think you found the right company. and you're sort of educating your partners on the why and the art of the possible and why this can be a truly enduring company, which you are well on your way to building. And then you also have that lived experience. So I'll never forget it because I had very recently welcomed our second daughter, and she needed a medication. And it, as a young baby, you want to get your kids what they need as quickly as possible. And the first time we had gotten this prescription was at Rite Aid in our town, and then we needed a refill a couple weeks later, 10 days later, and Rite Aid had already closed, but CVS was still open, and it was less than a mile down the road. So I was like, okay, well, I'll just get my refill here. And I walk in and go to check out, and the prescription cost was 40% higher than it was less than a mile down the road. And so I was like, wow, okay, so this is that time. I'm super fortunate that we have incredible insurance coverage, such that that pricing differential didn't sort of deeply impact me. But there are so many people in this country where that's not the case, and they perhaps wouldn't have been able to absorb that pricing differential.
I mean, one of the things that we used to do at my old company was we used to track acceptance rate at the register and how patients react to the copay.
Yeah.
And what people don't realize is when a patient is confronted with a $75 copay, 1 in 5 will reject the claims. 20% of the people will not pick up their prescription. And if you dig into that and you are able to ask the patient why didn't they pick up their prescription, they'll be like, I have to consider my grocery bill. I need to consider my heating bill. I need to consider my car payment, my phone payment. And what's interesting is you're pushing this medication down, and they just can't do it. And when it's $120, 1 in 3 Americans don't pick up their prescription, which is, again, a terrible situation for anyone. But I go back to your point, to a 40% difference in price, and we've seen 2,000% difference in price. And someone's like, how does a drug have a change in price that's 2,000% more expensive? And what people don't understand is when I was in pharmaceutical manufacturing, we only had 2 classification systems really for a drug. It was patent protected, it was a branded product, or it was off patent, it was a generic product. When I moved over to the insurance side, you get introduced to all these gray states. Like, it's a single source generic, it's a multi-source brand, it's a limited supply drug, it's a limited distribution product. And what this is creating is what I call false classification, that I can take a generic drug that should have a 90% discount from its starter price because it's off patent now, but magically transform it, even though it's the same drug, to a brand, and now charge you the innovator price that has been appreciating for time eternal. And so you can suddenly take a generic oncology drug that's been off patent for 10 years, turn it into a branded product, and charge the plan $2,000, $3,000 for a drug that's $200. And who would do this? I always say this, and I'm not the only one to observe this behavior. And this is also what frustrated me was, who would get into healthcare? Care is in the name of our industry, and this gets me so upset. But who would be a healthcare executive and allow this behavior to happen?
Right. And maybe just so double clicking into this, at the core of Judi is your conviction that high cost drugs in America are not because of what's required for investment to actually discover and manufacture the drug, but rather what happens from the point of manufacturer to the counter at the pharmacy or your doorstep. Can you just explain that in a little bit more detail?
So the way that I always tell people to think about it is, for 40 years, the pharmaceutical manufacturers were in charge of the supply chain. And what do I mean by that? They had the power. We release the drugs, we manufacture the drugs, we manufacture the generic drugs. We're in charge. Everyone downstream is a price taker, and this is how we manage things. And now some people would say that's not a great marketplace because someone has too much power.
Mm-hmm.
What happened around the 21st century was the rise of the PBM. And PBMs started to consolidate, which once was a fragmented healthcare system of prescription management. You start to see three companies kind of coalesce. You see CVS, Caremark, you see Express Scripts, which would become part of Cigna, and you see Catamaran, which would be purchased by Optum United Healthcare. And so you have these three entities in a very short period of time. By around, call it 2015, probably had 70% of the market. And by 2017, the end of their mergers, it had cleared easily, I would say 80-85% of purchasing power. And so that's a huge amount of concentrated, what I would say, purchasing power against pharma. And if you think about it, pharma, although that they continue to consolidate, there's still probably 40 major manufacturers around the world. But now you have three entities that are the gatekeepers. And one of the things, and this is an important thing to remember, is the PBM model, if you go back to the 80s and 90s, used to charge a flat administrative fee. We'll just charge you $2 a script to manage your benefit plan. And that's what PBMs did. In the 21st century, PBMs figured out, if I want to make more money, I need to make money on the drug. I can't just charge a service fee. I need to be part of that transaction. So I want to own a pharmacy, retail, mail, or specialty, and be the administrator. And I want to be what's called a GPO. I want to be part of some sort of group purchasing organization that is able to charge an administrative fee on branded product on top of these other fees. And I want to create price protection rules where I get paid on inflation. I want to control the rebate dollars. I want to create spread pricing models, which is all of my customers get different prices. Instead of just saying, hey, this drug is $100 for the next 6 months, and then it goes to $105 for the next 6 months, I'm going to have people pay $150 to $100. And you know what? As long as they pay, who cares? And what the PBM industry realized is they could charge more money for the same transaction by being part of different segments. It's called vertical integration.
Yeah.
And that vertical integration would later extend to even the physician side and medical insurance. But what was important to remember is the relationship between the manufacturer and the PBM. So the pharmaceutical manufacturers, they're going to increase the price of their drug year over year. And the PBMs realized we could create this concept of a formulary, which is I'm going to have preferred drugs, and I will be able to tell the pharmaceutical manufacturers, if you're a preferred product, we'll make the copay cheaper. So in the eyes of the patient, your drug is cheaper always. And this worked. And what was interesting is it worked so well, the PBM industry said, well, wait a second. What if I move beyond preferred and non-preferred and I go excluded? So you could go to your competitors and say, you know what? You're not on formulary because I've paid for this right. And how does this work is it became a game of what's called a rebate. People ask me all the time, what is a rebate? A rebate is, let's just say I were to buy this chair.
Yeah.
And I go to the furniture manufacturer and I say, hey, this is a lovely chair. I'll pay $200 for it. And they go, oh, great. Every chair you pay, I'll give you 10% back. I'll give you $20. So your net price on the chair is now $180. So great. Amazing. The PBMs said, well, wait a second. What if we ask for more rebate dollars? So instead of it just being 10%, what if we went to 40%? And to get that number, I will tell them that you will not just be preferred, I'll exclude your competitors. So you're the preferred chair, if you will, in my business model. My chairs will only come from you. And so this model works so well that the PBMs kept increasing their ask. So let's go back. You start at 10%, then you go to 15, then you go to 20, 25, and et cetera. And you'll get drugs that by the time their patent expires, they could be 60 to 70% rebate. because they just keep asking for more and more. So what's happening is, in order for, I try and explain this, if I'm a manufacturer and my drug is $100, let's just keep this pretty straightforward, and someone goes, hey, I want 10% next year for a rebate, well, we got to raise the price at least to 112 or 115 to pay for this 10% and still make a little bit more money. And that same group goes, well, now I want 15%. I'd be like, oh, I got to raise the price again. Now, people would say manufacturers always raise price, but they never raised price at such velocity because the ask was coming in. So long way around, you have a model now where pharma was in charge in the supply chain because they had more consolidated power. PBMs become more consolidated in power. They're asking for more rebate, which is pulling the pharmaceutical manufacturers to obviously increase price. Now, this is an opinion.
Yeah,
this is my hypothesis. But my proof point is when I entered the pharmaceutical manufacturing industry, the United States spent around 120 billion, 130 billion in top-end drug spend.
Mm-hmm.
This year, we're over $1 trillion.
Wow.
That's a compounding rate of inflation far in excess of anything like consumer price index, which, on a good year could be 2 to 3%. Drugs are 7 to 12. It's out of this world. And the American people accepted it for a period of time, and the employers and the people that sponsor benefit programs, because they couldn't necessarily see the impact on the member until the member became exposed to coinsurance or deductibles. And this goes back to someone's presented with $100 or more out-of-pocket expense. 1 in 3 don't pick up their prescriptions. And so, I go back, and on top of this, the price may not even be correct to begin with.
Right.
So you've got this super escalating price. You have complete opacity where no one knows what the real price of the drug is. And on top of it, intentional variability because it creates profitability for the PBMs. But more importantly, the confusion makes it hard for someone to really say, this is the fair price for this drug.
No reason why the industry has been slow to adopt anything that is transparent.
It's funny you say that you met me and this team had figured it out. I would like to point out I was 20 years into my career at that point.
Yeah, you
and
can tell.
Each of these chapters were instructive to me to create the solution.
As we are hearing, this is a very complicated problem space, right? There are a lot of incentives, a lot of really large companies participating. How would you describe what it is you're building at Judi Health to my 5-year-old daughter, Quinn?
Sure. It's very interesting, when I ask even my children, like, what is it that I do for a living? And what I'm trying to tell anyone to just describe very simply or elegantly what we do is we ensure that you have access to the care and medication that you need at the appropriate price, that not only you and your family can afford it, but any family in America. Because this is what I think is a fallacy, is that there's no such thing as good care at a reasonable price or access to reasonable prescription or medication programs in the United States. That's not true. It's the people that encumber price, these invisible or sometimes visible rent seekers that care nothing about the patient. And that's what I go back to is what is it that I do? Very simply, I would go to any person's, son or daughter and say, we make sure you and your family can get the care you need at the right price.
Well, thank you for that. I think there are so many people who are appreciative of the work that you've put in over so many decades and
fighting small companies.
Yes. We spend so much of our time here at GC thinking about how we can transform healthcare at scale and create new structures, incentives, care models to make the experience and sort of the cost structure consumable. Why would you say that what you're building at Judi is so critical to broader healthcare transformation? And obviously you started on the pharmacy side, you're moving now into medical, but maybe just talking about the broader transformation.
It's funny to answer that question. I'm going to ask you a question if you remember something. So I don't know if it was the first or second call that I met you. One of the things that I appreciated was your candor. And I'm halfway through our presentation and we had a natural pause and you just asked me point blank. They're like, yeah, Capital RX, like, I don't really like the name. And I've never really had someone just stop me in the presentation and be like, the name of your company stinks. Like, what's your plan to change the name of your company? And I don't know if you realize it, but you're the first person who made me kind of really crystallize the plan for the rebrand that would happen 4.5 years later or so. And I said, the name of our program is Judi. Judi is short for adjudication. She's the brains of our organization. And, to be fair, Capital RX was a domain name that was available. And I picked it. This is kind of sad. I picked the name
We all have
Capital
our
RX.
reasons.
Well, I picked the name Capital RX because it sounded like this company had been around a while. That if you heard it, it was like Consolidated or Continental or, it'd be like Capital. Like, I guess this company's been around a while. Because one of the hardest things that you have to do when you start a new business and you're selling to large entities is to kind of establish a brand in which people could trust and believe in. Like, you've done this before, right?
Yeah.
But you're the one who first asked me about this. Do you even remember this moment that you put me on the spot mid-presentation?
Yeah. Yeah, I do. In part, it was there was a question behind the question of, Capital RX is very specific. RX is in the name.
Yep.
It relates to the pharmaceutical industry and drug pricing, but, you have this incredible platform and a vision for transforming healthcare more broadly. And so how do you think about sort of what you are re-architecting in pharmacy? And how can you take that into other areas of healthcare? Because, again, it's so rare that you can find a team, a mission, a business model that can scale unlimitedly. And it felt like that potential was there.
Yeah.
And so it was really, less, it was really less about the name in and of itself and more about, okay, it feels like there's something bigger here.
Yeah, what's the second act?
And so what's the second act? And if it then, by the way, if there is a second act, maybe the name doesn't fit quite as well.
Well, but that was one of those moments. And when you asked me that question, always in the back of my head is the name of our system was Judi. And short for adjudication, which is a fancy word for processing or administration in the world of insurance or benefit administration. And so it was always there. And I remember saying to you, we're going to change the name to Judi Health one day. And the other thing that I was very remarkable is just how quickly you're like, oh, that's good. And we just moved on to back to the presentation again. But then 4.5 years later, we would do the rebrand when it was appropriate. But I think it goes back to the question that you originally asked, which was, what is it that we were truly trying to accomplish here? And, one of the things that I felt is there was too much waste in claim administration. And for us to compete with our competitors, because one of the core principles of our company is do not make money on drug spend. And people will be like, why? Your competitors, CVS, Cigna, and United, they make tons of money on drug spend. I go, but this is the problem. It never should have been this way. The industry didn't start here. We were true administrators as PBMs back in the day. We just charged a flat fee. And I try and make this point. The inherent conflict of interest, the moment you make money on drug spend as the trusted administrators, think about it. The more expensive the drug, the more money your administrator makes. I'm going to go a step further. The more fraud, waste, and abuse your PBM under this framework is also the beneficiary of these actions.
Right.
That's insanity. And here's something I touched upon earlier is I am clearly, there are millions of people in healthcare, professionals and consultants and brokers. Why am I the only one taking offense at these things? And one of the things that you learn very quickly is lots of people are making money on the drug spend. It's not just the PBM, it's could be a broker, could be a
Sure.
consultant, could be some sort of coalition. And I always want to point this out. We work with amazing brokers and consultants that are not focused on these
Right.
things. But unfortunately, there are a large number of people that will turn a blind eye
Mm-hmm.
until the good times stop rolling and they could stop charging money. And there's an entire segment that we could talk about on the shady behavior surrounding this industry. So the industry is already opaque and complex and has conflicts.
Mm-hmm.
And then there are people that represent themselves as professionals and advisors and consultants to help employers and benefit plans figure out this model. But they're on the payroll
Right.
of the PBMs as well. And so core principle, don't make money on drug spend. Remove that conflict. And the second part of it is effectively what we're saying is we make less money. And if you make less money, we have to become hyper efficient. If you
Right.
recall my original business plan, it would say we as an organization must administrate a claim 65 to 70% cheaper than our competitors in order to be effective. The only way to do that would be through a combination of transparency, but more importantly, efficiency. We must create a modern system to adjudicate these claims. And I want to be fair, when we started this company, that vision, we didn't know if it was even possible.
Right.
And I was like, I don't know if we want to build this level of platform and technology, because I want people to understand there's maybe been 3 or 4 claim processing systems at scale
Right.
in the
That's
United
wild.
States. That's it.
Yeah.
And to do this, lots of companies with billions of dollars have failed. And so we didn't take this lightly. And I go back to that question of conviction for you is it was so important for us to surround ourselves with people that believed in the mission and were willing to support us in a long-term outlook to achieve this goal. And that comes full circle to, it wasn't just about administrating prescription claims. It was any administrative workflow in healthcare. I often want people to understand, in healthcare, I often say there are kind of 2 invisible electronic workflows that surround a patient at any time. And one I talk about is electronic health records. This is kind of the workflow of decision support and scheduling in a hospital or physician group. And this kind of tracks the patient and codes if a procedure is being done or a medication is being prescribed. And that's what I call the creation of a claim. Now, a claim could be any noun. It's basically encapsulating what has occurred for that patient in that moment of time. Like I went in and I had a primary care visit. I went to the hospital and I had knee surgery. And that information is then sent to what's called the administrative layer. This is the other electronic workflow. And this is like, hey, I've got a claim. What do I do with it? And this is the sequencing of eligibility. Is someone in a benefit plan or not in a benefit plan? What's the plan design, both clinical and financial? Are you allowed to get this knee surgery or receive this prescription? What's your copay? What's your out-of-pocket cost? What's the network? Who's being billed? Who's being reimbursed? All of this information is in what we call adjudication. This is that workflow to adjudicate a claim and to basically have a patient access their care at the appropriate price. And so if you think about when we started this company, we started with pharmacy, but we realized everything was pretty much, I don't want to use the word rotten, but antiquated. And more importantly, these systems were all separate. They don't talk to each other. And it's creating member and provider abrasion. Like patients aren't having a great experience in the US healthcare system. Physicians will tell you they're exhausted in their staff trying to get these claims paid and obviously processed. Plans are exhausted as well because they can't make sense of these things. And this became Judi Health. This became our quest to become the true operating system that powers the healthcare system on what we call the administrative side, the adjudication side.
Yeah, I mean, thanks for explaining that, because the process of adjudicate, it's a very invisible and unsexy area of healthcare that no one really talks about because it's highly nuanced, but you made such an important point where it's like, if you have to have modern AI driven systems running that process, if you're ever going to be able to have a transparent management system on top of it that isn't making money off of drug pricing. That is how you can scale a business and do well by doing good in a
I
sort
don't
of
think
scaled
people
way.
understand this country, depending upon what numbers you use for US healthcare, is over 5 trillion
Yeah.
with a T. And I try and have people understand how expensive healthcare is in our country. Everyone thinks gasoline, gas prices, everyone fills, or lots of people fill their cars up with gas or use fossil fuels to power different forms of energy in the grid. But the point of it is it's a $180 billion market.
Right.
180 billion. Healthcare is 5 trillion.
Right.
And here's what's going to just, I think many times when someone hears us have this discussion, what is going to blow their mind is there's probably $1 trillion in waste. Not fraud, not abuse, just waste. Just people touching a claim that shouldn't. People charging something in this workflow that shouldn't even exist. People being charged for things that didn't exist in their coding.
Yeah.
People being overcharged for medication. Just the waste is at least $1 trillion. And that's why this is such an important mission.
Yeah. Thank you for that. When you announced the rebranding to Judi, which makes all the sense given what
someone told me the name stunk.
And you announced your unified claims vision, so we can for the first time have pharmacy and medical claims in one system. No one really knows why these things were purposefully separate to begin with, but that's a big undertaking, and for the company to expand in such a way, build out the systems, the go-to-market motion, the narrative, the branding. What were some of the unexpected challenges that you were faced with as you decided to go on this expansion
Let's
path?
start with the board of directors, Holly. So, when we did our fundraising, where I first met you, our Series C, I don't know if people fully understood why we wanted to raise the money, which was, yes, it was to scale out much of our core businesses because we were seeing demand.
But it was a beautiful business on its own.
Yes,
right?
It was. But there was a line item. There was a line item there.
Yeah.
And I go back to one of our other board members, Jared, at the time. And one of the things that many times when a portfolio company does a round of funding, you ask your board of directors or investors, take a look at it. Like, what do you think of my deck? Let me practice it once on you. Tell me what you think. I remember one of our board members took great exception that I had this section of unified claim processing. And I had like 4 slides on it in my deck, which is a bit excessive in a presentation for fundraising, as you would know. Space is precious.
Right.
And he was like, what are you doing? He's like, you are a pharmacy benefit company. What is this nonsense of medical and unified claim? Do you know how hard that would be? And I go, yes. But I think it's critical. And let's go back to my Netflix moment. I think this is our evolutionary path, is that we need to take on this task. And he paused, he considered everything, and he said, I'll give you 1 slide. Yeah. 1 slide you are allowed in. I put 2 in, take me to jail. But I put these 2 slides in, and when we did our Series C fundraising, there was this section at the very end, and it was on unified claim processing. And this was the realization this was going to be difficult. And we needed to find someone to process claims on. Now, what's interesting is we were growing at a very fast pace, and we had, in the United States, if you're, let's just say, over 500 employees, you become self-insured. And, the difference being fully insured business is if you're like a 20-person company and someone needs bypass surgery, that could be $1 million operation.
Right. And
that could be catastrophic to a 20-person firm or company. Once you're 500 lives, you can pay your own bills. You're self-insured because there's more savings. You're not paying what we call the risk corridor of premium, which could be anywhere from a 20 to 40% surcharge, depending upon experience and demographics. But the point was, we were self-insured, and I said, you know what we're going to do? we're going to do this to ourselves. We are going to move. Now, we already processed our pharmacy benefit ourselves, but I'm like, we're going to do the medical. We're going to do the medical claim processing and see how this goes. And I always want to make this fair is we're network agnostic, and we have great partners in that area. We work with lots of different national carriers, regional health plans, blues plans across the country. That's not our business model. Our business model is the administration of these things. So we started very quietly, I guess 3 years ago, processing our medical claims. And we didn't really talk about it to anyone. We're like, things are okay. Things are working. Our families are not angry with us. We're getting our medication. We're getting our benefits. We're seeing physicians. Babies are being born. Life is continuing. And we started to add additional features because just because you say pharmacy and medical, I don't think people understand all the subroutines and sub-workflows. So on the medical side, it's claim processing, but then there's TPA functions, third-party administrative functions. There's benefit administrative functions of eligibility and registration, and this is boring as heck. And then there's, payments and payment integrity and navigation, and all these things kind of build into a layer of service that, if it's done correctly, forms a benefit. And so we started to build out all of these things because, back to our thesis, which is every time another party touches a claim, it's taking money away from the patient and the plan. So if you have 30 different vendors touching a claim, that's 30 rent seekers.
Right.
And a lot of people don't even know they exist because they're like, oh no, I have one contract. And I go, no, they have sub vendors and sub arrangements. And so zero dependencies became our new thesis on claim processing. And one, it was to get rid of all of the rent seeking. The other thing that people don't understand in the United States is whenever you process a claim and you pass it to a different vendor, it's already wrong. Because in seconds in the United States, claims are paid, claims are reversed, things are coded, recoded, people are eligible, ineligible, it's too late. I've passed that claim to a new system, and that system and that vendor is making its own observations and adding or appending actions to that claim and sending it to another vendor and another vendor and another vendor. And, I think most people understand U.S. healthcare is complex and it's screwed up. But what I don't think people realize is almost every single claim is wrong in the United States. Maybe not materially wrong, but there's definitely aspects of it that are inaccurate. And it's because all these vendors are touching a claim at different points in time. And then you get back to the beginning of the journey of the claim, the adjudication. And you would think that there's this really cool programmatic way that we maintain claim integrity, the accuracy of the claim. And there isn't. Close enough is the rallying cry for the U.S. healthcare system. And the only time anybody cares is if they're being audited or litigated. That is the truth. And for us, it was, how do we fix this? So by having all of these workflows on one system, there's no gaps in eligibility. There's no gaps in financial information. There's no gaps in patient records. There's no gaps in experience. When we were doing our last round of funding, I remember speaking with this woman who was the head of a very large investment bank. And she said, stop your presentation. I want to share something with you. And I was like, oh, okay. And she goes, I couldn't agree more about this patient abrasion and confusion in this process. She's like, I just had a child. And, I'm back at work now, and I get a phone call from the health system, the provider that, helped me deliver the baby, say, hey, you owe us X for this. And she's like, oh, okay, I'll get that to you. She gets a call the next day from her carrier, and it says, you owe me Y for this procedure. She's like, okay. And then another company calls, and they say there's some sort of integrity system that helps the carrier, and the new price is Z.
Wow.
And she said, I have a PhD from Stanford, and I don't understand what's going on. How does the average American have a chance? And I think this is why people don't even want to use healthcare, because it's so confusing, and people are deathly afraid. It is one of the major reasons for bankruptcy in this country as well.
Absolutely.
And you don't know which price is right. You do not know who's advocating for you truthfully. And it's because there's massive conflicts of interest that have been left unchecked for the better part of 30 years
Mm-hmm.
in this country. And that's frightening to me on so many levels. And it goes back to the privilege we're given by you and our other board members and our investors to tackle such a huge problem in this country and work towards a solution.